Hi, I'm Spencer.
Hey everybody, I'm Victoria.
And I'm Jasmine, and today we're going to be talking about performance enhancing drug use in adolescents. Okay, so performance enhancing drugs can be defined as any substance that is used to alter one's performance. This can be by increasing muscle mass, decreasing body weight or fat mass, and reducing pain. Now, some common performance enhancing drugs are anabolic steroids, human growth hormone, amphetamines or stimulants, blood doping, diuretics, and creatine, but today we're only going to cover the first four. Okay, moving on to anabolic steroids. Anabolic steroids are a synthetic derivative of testosterone, and they're typically used to increase muscle mass and strength and decrease fat mass. If you hear about the use of steroids or performance enhancing drugs in the news, it's probably referring to people who are professional athletes, and it can be administered orally, topically, or via injection. The mechanism of action is it upregulates genes that are responsible for muscle mass, and it counteracts glucocorticoids, which we just learned about in internal medicine. And the use of anabolic steroids is typically illegal, but it may be prescribed by your physician in men who have low natural hormone levels, boys who have delayed onset of puberty, or those who have muscular atrophy due to underlying disease. Okay, human growth hormone is taken with the intention of increasing muscle mass and decreasing fat mass, so similar to the anabolic steroids. It is also administered via injection, and this works by promoting growth via insulin-like growth factor 1, protein breakdown, and lipolysis. Now, this may be prescribed by a doctor, but again, it is typically used illegally. Amphetamines and stimulants, these are probably the most accessible. It can include energy drinks or anything caffeinated, ADD medication, and even certain cough suppressants. And these are typically used to increase energy, muscular blood flow, speed, strength, endurance, and power. Now, these are administered orally via injection or inhalation and work by stimulating norepinephrine in the central nervous system. Okay, last one we're going to talk about is blood doping, and this involves injection of whole blood, red blood cells, or erythropoietin into the bloodstream. It's typically done to increase the oxygen carrying capacity of the blood, therefore leading to higher muscular endurance. It can decrease the frequency or intensity of muscle cramps, again, administered via injection, and it works by increasing red blood cell production, which increases the amount of oxygen that can be transported within the body.
Great. So, prevalence of performance enhancing drug use in adolescents, specifically in high school athletes, ranges from 10 to 23%, and 1.6 to 5.4% of high school athletes use anabolic steroids specifically. So, performance enhancing drug use is 2 to 3 times higher in males compared to females, and students involved in school athletics are more likely to use steroids than those who are not. 30 to 40% of high school students who participate in performance enhancing drug uses are not involved in high school sports. So, and a lot of this comes down to, like we said, that male versus female and other types of motivation that lead to performance enhancing drug usage in teens. So, for example, to cope with body image insecurities, to fit in with peers, to gain muscle mass or strength, to increase endurance, or to perform better or gain a competitive edge. And a lot of that can come from, like I was just saying, being in competitive sports, wanting to compete with your peers, be with your peers, or also just the environment and the availability of certain things. The other thing is a study that was conducted by Mudrick et al. In 2018 that consisted of a group of 16-year-olds. They argued that intrinsic enjoyment, self-referenced criteria of success, and self-improvement are all related to more negative opinions of performance-enhancing drug use in adolescents. So if we look at this figure here, we can see the correlations between certain factors, such as intrinsic motivation, which has that strong correlation, that higher p-value, that higher positive p-value between task orientation and winning, whereas it has that strong negative p-value or that negative relationship with attitudes towards doping, acceptance of cheating, and then that really, really strong correlation between acceptance of cheating and doping. So basically what we get from that is that, like I said, that intrinsic enjoyment, self-referenced idea of success, self-improvement, all of that is a way to get teens away from performance enhancing drug use and avoid that kind of thing. So for side effects and adverse reactions, as you can see, there is a long, extensive list of things that our 4 examples here have. One big one that you hear about a lot is mood swings, or what's commonly referred to as roid rage. That's from anabolic steroids. And you can also get other side effects that maybe don't feel as disastrous, like nausea, bloating, headache. And then you can get other more disastrous adverse reactions like cancer, cardiovascular disease, and even sudden death in some cases, like stimulants. So there's a lot of things that we need to consider here, and that also comes from knowing a PT standpoint, so maybe joint pain or muscle pain. So that has a big impact on a person's ability to move and be physically active. Like I was saying, anabolic steroids are known to cause joint pain and weaken tendons. Human growth hormone can cause joint and muscular pain as well as muscle weakness, and blood doping is associated with hypertension, myocardial infarction, and pulmonary embolism.
So there's lots of different mechanisms that can be used to test for performance enhancing drug usage. For anabolic steroids, usually urine immunoassay is used. For human growth hormones, they use a naturally derived GGH ratio. With stimulants, usually a urine quantitative analysis can be performed, and then with blood doping, we can use an athlete biological passport. So what can PTs do? The main goal for treating PED usage would be early intervention with educational programs focusing specifically on awareness and also trying to change attitudes and community norms on uses, especially with these adolescent athletes. We want to discourage the use of using PEDs to increase muscle mass. And PTs can kind of help through encouraging strength programs to avoid this supplemental usage. Further studies may be needed to help form effective programs on preventing the use of these banned PEDs. And then PTs can also treat certain side effects such as the muscle pain and joint pain that we talked about. So in summary, performance enhancing drugs are classified as any substance that is used to alter one's performance in sports by increasing muscle mass, decreasing body weight, and reducing pain. The common examples that we focused on were the anabolic steroids, human growth hormone, stimulants, and blood doping. Teens usually experiment with PEDs in order to cope with body image securities, to fit in with their peers, to gain muscle mass and strength, and especially to gain that competitive edge or perform better in their chosen sport. The main goal for treating performance enhancing drugs is a focus on early intervention with educational programs, focusing on awareness and changing the attitudes of these adolescent athletes. So now we're going to just kind of run through a knowledge check. Which of the following is not a motivator for adolescent usage of performance enhancing drugs? So we'll give you all a little bit to kind of think on that. Okay, so you should have picked increase in stroke volume. As we talked about in the adverse side effects, there's a lot of side effects that can kind of impact the way your heart functions. So definitely these aren't going to be increasing your stroke volume. Next, what percentage of high school athletes and students use performance enhancing drugs? So 10 to 23% of students are going to be using these performance enhancing drugs. And we hope that y'all enjoyed our presentation.